Do you have trouble remembering the parts of the heart? I have found that if you draw the heart, you'll learn it better. You'll be able to understand the physiology of it, how it pumps, what's going on inside, outside. So I'd like you to grab a pen and paper or pencil. I'll wait. Let's get started. So I deconstruct everything first. Everything is based on the most fundamental objects of that said object that we're creating. I don't know if that made sense, but it did in my head. So I'm going to start with a big circle. And to make my circles, I just go around and around, kind of like working at the bedside. You just keep going around and around. I like making these circles nice and light. So that's kind of a circle, but it'll work because it's going to get erased anyway. The heart starts going like this. And I'm looking at a reference right now. I'm not pulling this off the top of my head. Do you want to see what I pulled off the top of my head? It was kind of cool. It was abstract, but it was wrong anatomically. So now I'm looking at a reference. Don't shoot me. I forgot to introduce myself. I'm John. I am an artist turned ICU nurse. I've studied art for over 20 years. I make art, a lot of it, a lot of paintings, a lot of abstract paintings. It's a good outlet for me. With the stuff I see in the ICU, it's just a good outlet. I've been at the bedside for over 10 years. Something's wrong with me. I still like it. I'm also an ICU educator, and I have a website that you might like, rnartline.com. It's got a whole bunch of good stuff there. Books, stickers, t-shirts that I made. It's all my stuff. It's all my designs. You should check it out when you have time, but not right now. We're drawing. God, sorry to interrupt. Back to the anatomical heart. Again, we just started with the circle just to break it down. How the heck did that happen? I don't like that. Darn. Let's see how that goes. So we started with the circle, and again, I went around a few times, and I just start segmenting this guy out. That's the right atrium. So right now, I got the right side of the heart done with the basic fundamentals: the right atrium, the right ventricle, and then the pulmonary artery. Wow, that took a second. The pulmonary artery. So now we're going to work on the left side of the heart, and again, just basic shapes, just breaking down the heart to the most fundamental foundational shapes that we know. So left atrium, and then, all right, moving up to the aorta, we got the superior vena cava right here. I always like putting these guys together, the superior and the inferior vena cava. All right, here comes the fun part, erasing it. So I just want those lines just barely there. And these are some of my favorite erasers. They're just rubber. Back to erasing. Sometimes it's fun coming home and drawing stuff after a nice shift, a shift that really kicks your butt. And you draw a little bit, and then you get to erase, and it's like an analogy of that shift. You just get to erase that shift and never think about it again. So the people that you meet in nursing or medicine, they can really take it out of you. And so this, by drawing, by staying focused and learning at the same time, you allow yourself a reprieve and a forgetting, a letting go. And it's nice. You are advocating for yourself mentally. So if you've had a bad shift, I encourage you to come home and leave the shift at the hospital. Come home and draw a little bit and then erase it or burn it or throw it away. Just forget about it. And just like that shift, you get to let it go. Wow, that was a tangent. Back to drawing. Let's go dark like my soul. I still get the sleep. Well, all right, we're going dark and seeing a little bit. Did that wrong. Sometimes I forget to talk. I get really into this and it's just fascinating. It's fun to draw. And it's fun to think of the experiences I've had taking care of patients with hearts that didn't work so well. I remember a lady, she had a papillary rupture. So this thing right here, that is your papillary muscles. This guy, it connects the tricuspid valve to the actual muscle itself, the myocardium. And she had a rupture right there. It snapped that off and she lived. We did a good job. She went to cardiothoracic surgery, got it fixed, came to us, CICU, and we took good care of her and she lived through the experience. And that was neat. It's neat reminding yourself of some of the things that you've seen. I don't know about you, but the aortic valve, it looks like, I'm going to get a little juvenile here. It looks like a little butt and it's taking a duker. I don't know. I'm going to remember the aortic valve taking a duke in the left ventricle now. I think that's pretty good. I wish I drew it more this way, longer, a little bit more longitude. Maybe if I did it out here, maybe. I think that would look better, but I'm stuck with it. I think it looks pretty cool. How about we do the path of the blood flow? That took a minute. So we got the superior vena cava, and blood, deoxygenated blood, is coming in via the top half and the lower half. So the superior meaning higher and the inferior meaning lower. And venous deoxygenated blood is coming back into the right atrium. So the blood goes into the right atrium. The tricuspid valve opens and allows that blood that just entered the right atrium into the right ventricle. The tricuspid valve closes. The SA node, through its firing, reaches down into the Purkinje fibers running along this way in the myocardium. And the blood flow, because of the right ventricular contraction, flows up past the pulmonic vein into the pulmonary arteries, out into the lungs and it gets oxygenated through a whole different process that is crazy. On the way back, it's coming into the left atrium from the lungs. So now we have oxygenated blood, goes into the left atrium via the pulmonary vein, and then it gets dumped into the left ventricle by the mitral valve. And again, that mitral valve, it looks like a clam like that, just opening. And it's just two leaflets. That looks kind of cool on camera. Maybe this guy should be like a puppet, Mr. Mitral. Sorry. That's so stupid. Mitral valve into the left ventricle. This is the workhorse of your heart. It has the most strength of your heart. So it's going to be very, very strong into the aorta. It goes past the aortic valve into the aorta to oxygenate, hopefully, your brain and my brain. I'm missing some cells up there. Goes down the aorta. So top half feeding into our arms, and then bottom half leading into our vital organs and our legs. Maybe we could just talk about this stuff. So endocardium, myocardium, and then we have the epicardium. We've got the papillary muscles that we talked about earlier, that poor woman who had a papillary rupture. That was big trouble for her, but we fixed her. You've got the aortic semilunar valve, the pulmonary semilunar valve, the mitral valve or the bicuspid, remember, two, bi. I was going to do something stupid right there. I'm glad I didn't. Left pulmonary veins. We've got the left atrium and the left pulmonary artery, the right pulmonary artery over here. Again, the aorta, the superior vena cava, the right atrium, right ventricle, tricuspid valve on the right side. This is the chordae tendiae. That's how I pronounce it. Comment below if you disagree. The trabecular, I'm going to mess this one up. You can ding me for this. The trabeculae carnae. And that's this opening stuff in the right and left ventricle. Beat me up on that one. And I think that's it. There's probably some more stuff we can really focus into, but I'm tired. I really hope you enjoyed this. And I have a field guide about central venous catheters on my website, rnartline.com. I have awesome shirts that I made. This one's B52 Sedation Strike Force. It's got sedation raining down on the people who need it. I need it. rnartline.com. My name's John, ICU educator, artist. Let's see where this goes. Follow on for more. Like this if you like this. And I think I'm going to color this one in. Let's get weird. All right. See you on the next one. I should probably say, here's this video next for more engagement. Engage. See you next time.